Hi, everyone. My name is Kelly Setoguchi. I am a physician assistant, and I've been working in cosmetic dermatology and medical aesthetics for the last 5 years. I am just joining the Illuminate team, and I'm excited to introduce some new technology to Illuminate and all of its wonderful patients. I have specialized in working with light and laser devices. I've actually been involved in some of the research and development for some of the technologies I'm going to talk about today. I also do injectables, but today I'm going to focus on two specific treatments. The first one being BBL or broadband light, and the next one being the Moxie laser. My goal today is just to give you insight and to see if you would be a good candidate for these treatments, for either of these treatments, and what it would look like to sign up for one or both of the treatments. So let's go ahead and jump right in. We'll start with BBL. BBL is a very specialized form of IPL, which stands for intense pulse light. So we're using energy to treat specific skin concerns such as pigmentation or redness. The heat that it generates also stimulates collagen to help with texture and tightening. So what does BBL treat? BBL is a really versatile device because it treats a wide array of many cosmetic concerns. Here's a general list of them. I'm going to break it down for you here in the next couple slides. So redness, rosacea, and vessels. BBL is my go-to treatment for rosacea. I've had patients come to me and tell me that they've tried everything over the counters, different laser treatments, different prescription medications, and nothing can control their rosacea. It can be a stubborn, really uncomfortable and frustrating condition to treat. I haven't met a case of rosacea that hasn't at least improved with BBL. We can get most cases in remission and keep it there with regular BBL treatments. Redness, broken capillaries, very typical of sun damage. These respond really, really well to BBL as well. Scars and acne. BBL works incredibly well on pigmented scars, so anything that has pink, purple, reds, any scar that has color. It'll make the scars lighter, smoother, and flatter. Acne and acne scars. We have a 3-step protocol for acne treatments. It works to address different components of the acne and the acne scars. This can be a really frustrating condition, not only in adolescents, but we have a lot of patients that struggle with adult acne. So helping prevent future breakouts, improve any marks that have been left by acne, and then decreasing current breakouts. BBL is great for pigmentation, fine pigmentation, freckles, age spots, birthmarks, melasma, any type of brown discoloration. It improves texture, it makes the skin appear smoother, and it also brightens the skin. One side effect of BBL, as with all IPL treatments, is that it reduces hair growth. We can use this to our advantage in people who want unwanted facial hair. It's a side effect that we embrace. For men who don't want to decrease facial hair, we customize that treatment for them to avoid the side effect, but we can use it to our advantage or we can avoid it if we need to. So patients report that after they get a BBL treatment, their skin looks clearer, smoother, brighter, tighter, and healthier. These are all words that patients have used to describe their skin when I ask them when they come back for a follow-up and I say, what's the difference that you see in your skin? These are all words that are descriptive words from patients themselves. I will note that this patient also had some neurotoxin in her forehead, so some of that smoothness is from the Botox. But this was just after one BBL treatment. One unique thing to BBL is that it slows down the way that skin ages. And what I mean by that is there are studies that have been done at Stanford that looked at the DNA of skin cells treated with BBL versus not treated with BBL. And it found that the BBL promotes gene expression pattern of young skin. So basically, they compared 40-year-old untreated skin to that of 20-year-olds, and then 40-year-old treated skin to that of 20-year-olds. And the skin treated with BBL looked more similar to that of 20-year-olds. So we're not only making the skin appear more youthful, we're rejuvenating it at a molecular level and making it behave more youthful as well. I always like to touch on a few things that BBL will not treat, just so that patients are aware. It's not going to treat any raised growth such as the ones here, but we do have methods in the office that we can get rid of these as well. So how many treatments am I going to need for BBL. Sorry, let me move my screen there. We always start with a corrective series unless you've already had BBL done elsewhere. This series typically takes 3 to 5 treatments. We space them out every 3 to 4 weeks. Once we get your skin looking really great, we want to keep it that way, and we do this with regular treatments at intervals of 1 to 4 times per year. We call this our Forever Young protocol. This number, the 1 to 4 treatments, varies based on a few factors such as age, genetics, sun exposures, personal schedule, and then also budget we factor in. The best results of BBL come from regular, consistent treatments. Doing that initial corrective series and then doing the Forever Young treatments with however many treatments we decide together is right for you on that yearly basis. This is my skin after doing BBL treatments every 3 to 4 months over the past 5 years. You can see that just like my patients describe their skin, my skin looks clearer, brighter, smoother, healthier, younger. Sometimes my friends will joke and they'll say, Kelly, it looks like you're wearing a filter on your face. I love that comment because people who get BBL treatments regularly find that they're having to cover up less and they're wearing less and less makeup or cover up, and their skin is looking better without it. So what areas can BBL treat? Anywhere that there's skin. Most commonly people will come in and they'll be getting regular treatments on face, neck, chest, or décolleté. But we can treat arms, hands, legs, back, abdomen, anywhere that there are any cosmetic concerns such as pigmentation, redness, texture, crepiness of that skin. What to expect on treatment day. So we always take pre-treatment photos. We take that with our Visio, which helps us visualize the sun damage, redness, texture changes. Then we numb you with some topical numbing cream for about 10 to 15 minutes. Most people decide later in the series to skip the numbing cream because it's really not that necessary. But in the beginning, it just kind of takes the edge off when you're not certain of how it's going to feel. Treatment time varies from 15 to 30 minutes, depending on how many areas we're treating. During that treatment, you'll feel a little bit of warmth. We go over each area multiple times. So as we go over it, it heats up a little bit. Some of the steps are a little bit snappier than others. Some people describe it like a rubber band snapping on your skin. That's kind of the description of a typical IPL, which some of the BBL will replicate some of that feeling, but most of it is really generally well tolerated. Some people feel absolutely nothing. BBL is really well tolerated with very little sensitivity afterwards. Some people will have a sensation of like a warm sunburn. Downtime. We call our BBL essentially our no downtime procedure. And the reason for that is because you can put makeup on immediately after the treatment. We're not creating little holes or microchannels in the skin like we would with microneedling or lasers. So we're not concerned about any infection. The only evidence you'll have of the treatment is some mild redness, which can last anywhere between 30 minutes to a few days, depending on how strong of the settings we choose. And any pigmentation that's on your skin will rise to the surface over the following 24 hours. And then over the course of about a week, it gradually lightens. Sometimes it'll slough off. You'll hear the word coffee grounds used in association with IPLs and BBLs. So you could get a little bit of texture on your skin. And then we just want to make sure that we schedule your BBL, that you're not, on your way to Hawaii or Mexico, anywhere that you're going to get a lot of sun exposure. We want to limit sun exposure after the BBL for about at least 1 to 2 weeks. So that wraps up our talk on BBL. I'm going to transition now to the Moxie laser. Moxie is a fractionated laser that Sciton came out with in 2020. You'll hear the word fractionated lasers a lot in this industry. In simplest terms, what that means is that the laser is not hitting 100% of your skin. It hits a density, let's say 15%, 20%, 30% of your skin, which we choose those settings in your treatment. And it leaves the surrounding area intact. That promotes faster wound healing, which means less downtime. What made everyone so excited about Moxie when it was launched in the beginning is that it's safe on all skin types. Living in the Bay Area, we have a lot of diversity here. We were all really excited to get something that would be safe on all of our patients and get really great effective results. Moxie is known for its ability to improve pigmentation. That was what it was initially marketed as. It's my go-to choice for anyone who has melasma because it's gentle enough to treat this really stubborn condition, but it is also effective enough to make improvements in the condition. Moxie also improves texture, pore size. It's great for our younger patients who are looking to kind of stay ahead of the signs of aging. So we call that prejuvenation. But it's also great for the more mature skin looking to improve signs of aging that are already present. And then again, it's safe on all skin types, which is really amazing. How many treatments will it take? This varies a little bit more with Moxie than BBL, but typically between 1 and 3 treatments. We space those out 4 weeks as well. And then we really customize it if we decide that we're going to combine it with BBL. Sometimes we'll do 1 to 2 treatments of Moxie, followed by a few standalone treatments of BBL. Sometimes we'll do BBL first and then follow it up with Moxie. Some people are only a good candidate for Moxie, so it might be 2 or 3 treatments of Moxie. After we get your skin where we really want it to be, we're doing anywhere between 1 and 2 Moxie treatments a year, and that can vary also depending on if we're doing the Forever Young BBL treatments as well. So what to expect on treatment day. Let me see if I can get this video working so you can just kind of see what it would look like on treatment day. So like BBL, you'll take pre-treatment photos. We're going to have you numb for about 15 to 20 minutes, a little bit longer than for the BBL. Moxie is a very quick treatment. It takes 5 to 7 minutes sometimes. If we're going to treat your full face, a little bit longer if we're going to include neck and chest. Immediately after, you're going to feel a really strong sensation of warmth, but then we put some cooling masks on it to help bring down the heat and that redness. Usually people like to get into the car immediately after, blow the cold air conditioning on, and then by the time you get home, that sensation of heat has generally subsided. Oops. Let's go here. Here we go. Downtime for Moxie. Let me move this so you can see the photos here. This is my own personal photo journal of my Moxie treatment. There will be a little bit more downtime with the Moxie compared to the BBL. The night of, you'll be a little bit red. You'll see here, this is the night of. A little bit red. The following day, you'll have some swelling. I have some swelling here under my eyes. Anywhere we go a little bit more aggressive. And then you'll have really rough, dry skin. 24 hours after the treatment, you can apply makeup. And over the course of the next week, that dryness, that roughness will gradually slough off. So this is, you can see 3 days post-treatment. And then by 7 days post-treatment, my skin's looking pretty clear and bright. Combination treatments, we love to combine BBL and Moxie. I touched a little earlier on how we would customize the treatment plan specific to you, your skin type, what your skin goals are, and what you want your experience to be. The 2 technologies are great individually, but they work synergistically together and they can really enhance the results of each other. So a lot of times we're combining these 2 treatments, whether it's in the same treatment day or just in your overall treatment plan. So that wraps up my talk for today. Thank you so much for joining me to learn more about BBL and Moxie. If you have any specific questions, please reach out. My email is at the bottom of the slide. I'm happy to answer any and all questions. For those of you who've watched the webinar and completed the pre-screening questionnaire, you are eligible for a free consultation with me. Right now is the best time to start thinking about the light and laser treatments because as we head into the fall and the winter, there's less sun to be conscious of. So it's a great time to get started on your series. Call the office to schedule a consultation, or if you have any questions that you want cleared up before we schedule a consultation, go ahead and shoot me an email. I look forward to seeing you.